Arda has kept her husband's ashes at home since he died in 2022. This 77-year-old woman has terminal bone cancer and wishes to die through euthanasia. She's already planned what will happen next.
My daughters will scatter both our ashes over the sea, near Terschelling.
The Netherlands was the first country in the world to legalise euthanasia in 2001. The procedure can only be carried out by a doctor, with another physician agreeing that requirements like free will and unbearable suffering are met. Dr. van Schoten guides his patients through the process. He has started a practice specifically dedicated to those who wish to end their lives. Arda's husband also wanted to die through euthanasia, but because he suffered from meningitis, his general practitioner was unwilling to help. Klaas ended up dying naturally, but Arda wants to make sure she can choose when to go.
This means a lot to me. It gives me the confidence to move forward, to have an acceptable death without suffering. The idea that I will not have to live through this. I think that for my daughters, it's a good thing that they don't have to see their mother suffer, because it would only cause them sadness, and at that point, prolonging a life is really useless.
90% of euthanasia cases in the Netherlands involve ending physical suffering. But according to Dr. van Schoten, cases are becoming more complex, making practices like his indispensable.
The majority of requests for euthanasia are carried out by general practitioners, but their workload keeps growing. On top of that, people are getting older and the complexity of the physical and mental conditions of people who request euthanasia is growing.
Patients who struggle to exercise this right can turn to organizations like the NVVE. 20 years ago, less than 2,000 people died through euthanasia. Last year, it was more than 9,000. From the outset, cases of psychological suffering were incorporated into the law.
A psychiatric condition or dementia is also a medical condition, so they're allowed to receive euthanasia under this law. But it also requires improvements in the knowledge of doctors, because doctors sometimes don't always know exactly what is and isn't allowed, and so they sit on the safe side.
More and more doctors are refusing to carry out euthanasia because they are concerned how the practice has evolved, says this ethics professor.
Initially, euthanasia would be a very good idea to solve unbearable suffering at the end of life. But now physicians have the idea that euthanasia becomes a way to actually deal with life itself. And from that perspective, physicians say, in that case, I will not be misused in performing euthanasia, which is basically suicide.
This psychologist volunteers at an association that listens to those who wish to die but do not meet the criteria for euthanasia.
This patient has Agent X. He showed it to me.
Agent X, also known as suicide powder, is an illegal product that can cause a painful death. To avoid this kind of tragedy, this doctor favours the introduction of a second law, which will regulate cases that currently do not qualify for euthanasia.
These people cannot be helped by the regular healthcare system, even though I think there should be a possibility for that. Especially because there is a whole generation of people, baby boomers, who are used to making their own plans and deciding when is it enough for me. And I think we will not be able to avoid creating a space for that.
That debate is all the more heated in the Netherlands as several people are currently being tried for having provided Agent X. They're part of an organisation that advocates for the right to die and bypasses the Dutch rules. At 19, Ximena committed suicide by taking the product. Her body was completely blue when she was found. It's an inhumane death, says her father, who now fights to prevent other youngsters from taking the same route.
She writes in the last letter that I know this is fast, sure and painless. We get a lot of young people who've taken the substance on the basis of that promise. That's why we're so against this agent. We have a very good euthanasia law in the Netherlands.
Currently, euthanasia accounts for only 4% of deaths in the Netherlands, but the debate about the end of life is still very much alive.